So one of the things that we're, I think, all realizing in the mental health field is that the field is becoming increasingly complex. The science, the delivery of care, the kind of presentations we're seeing are increasingly complex. And for clinicians to keep up with this, we need to have an increasingly sophisticated understanding of mental health, both how brain, mind, and behavior all interface with one another. And to that end, we need to have a greater focus on integration of the kind of care that we're giving. We're seeing more demand from places like primary care to have a presence in psychiatry because they're realizing that psychiatry influences all health outcomes. If patients with heart failure are depressed, they're going to have worse outcomes. They're not only going to take worse care of themselves, but the presence of depression actually is going to predispose them to greater complication rates, to greater mortality rates. We're also seeing a realization that some of the silos that we've created in the delivery of mental health care are rather artificial. So we talk about this split care model where there's therapists doing one piece of the work and pharmacologists doing another piece of the work, but realizing that pharmacologists are doing therapy and therapists are needing to understand neurobiology in order to do their work. And Psych Congress brings these two things together and says, hey, these are not separate distinct entities. We are all overlapping in our roles, and we need to all understand what each other is doing, and to not only just appreciate that, but to further the work that we're all doing. I'm also seeing more of a trend towards being able to measure our outcomes. For years in mental health, we said, well, the patient's doing better. That's great. Or we said, oh, the patient's doing worse. But nobody was actually really measuring that in the same way that we do in other areas. When we're treating hypertension, for example, we have numbers that we can look at and say, hey, is this hypertension getting worse or is it getting better? How's our treatment doing? We don't do so much of that in psychiatry, but increasingly we're being called upon to do that, not only by the people who are paying for our work, but also from our patients. They want to see outcomes that they are actually indeed getting better. And we're talking in Psych Congress about how do you take that information and not just make it a chore, not just make it some task that one has to complete to satisfy some outside party, but really how do you take that information and integrate it into your care? How do you make that a feedback loop that helps our patients see that they're getting better? We're also looking really outside the box when it comes to psychopharmacology. We're bringing presenters in. We're going to be talking about things like the use of ketamine or other glutamate receptor antagonists for the treatment of depression. Or we're bringing in a presenter who's going to be talking about the use of MDMA for the treatment of post-traumatic stress disorder and the really exciting outcomes that they're getting in their early research. So these are the kind of things that we see coming in the future and that we want to bring to clinicians who come to Psych Congress.